If your heart is failing right now, your body is already warning you. But most people have no idea what to look for, and that's exactly why I need to share this with you today. Here's something that breaks my heart. Every single year, more than 1 million Americans end up in the emergency room because of heart failure. And the truly sad part? For most of them, the warning signs had been showing up for months, sometimes even years. Their bodies were practically screaming for help. But nobody was listening. Nobody knew what to look for. And by the time they ended up in that hospital bed, so much damage had already been done. Damage that could have been prevented. I don't want that to happen to you. I don't want that to happen to anyone you love. So right now, I'm going to show you something that could genuinely change everything. It's a simple test you can do right in your living room. Takes about 3 minutes. No equipment needed except maybe a watch or your phone. And this isn't some internet trick. This is something heart doctors actually use to catch problems early, before they become emergencies. Now let me explain something important first, because there's a lot of confusion about what heart failure actually means. When people hear those words, they think the heart just stops. That's not it at all. Heart failure means your heart isn't pumping as strongly as it should. Imagine a garden hose that's lost some of its pressure. Water still comes out, but it's weaker, not enough to reach where it needs to go. That's what's happening inside your body when your heart starts to struggle. Your organs aren't getting the blood flow they need. Your body tries to compensate. It works harder. But that extra effort takes a toll. And here's the part that really gets me. This can go on quietly for a year, 2 years, sometimes even 3, before you feel sick enough to think something's seriously wrong. And this is where it gets really frustrating. The early signs are so easy to brush off. You feel a little more tired than usual. You get winded going up the stairs. Your ankles look a little puffy at the end of the day. What do most people do? They blame getting older. They think they're just out of shape. They figure it's the weather. And sometimes, even doctors miss it during those quick checkups where they only have a few minutes with you. There was a study done not too long ago that followed thousands of adults over 65 for 5 years. And what they found was shocking. More than 40% of the people who were eventually diagnosed with heart failure had shown warning signs for at least 18 months before anyone did anything about it. 18 months. That's a 1.5 years of missed opportunities. A 1.5 years where the right treatment could have made all the difference. So let's talk about this test. It's called the sit-to-stand heart rate recovery test. I know that sounds complicated, but I promise you, it's one of the simplest things you'll ever do. All you need is a sturdy chair, something to track time, and ideally one of those little devices that clips on your finger to measure your heart rate. You can pick one up at any drugstore for less than $20. But if you don't have one, that's okay. You can check your pulse the old-fashioned way by pressing 2 fingers against the inside of your wrist, counting the beats for 30 seconds, and then doubling that number. Here's how you do it. First, sit quietly in your chair for about 2 minutes. Don't talk, don't check your phone. Just breathe normally and let your body settle down. When those 2 minutes are up, check your heart rate and remember that number. That's your resting rate. Now comes the active part. Stand up from the chair and sit back down. Do this 10 times at a comfortable pace. Don't rush, but don't take long breaks between each one either. Most people finish this in about a minute or so. The moment you complete that 10th stand, check your heart rate immediately. Write it down, then sit still for exactly 60 seconds and check it one more time. What you're looking for is how quickly your heart recovers. A healthy heart that's pumping well will slow down noticeably in that first minute after you stop moving. For someone over 60, a drop of 12 beats per minute or more is a good sign. It means your heart is responding the way it should. But if your heart rate barely budged, if it only dropped by 5 or 6 beats or even less during that whole minute, that's something you need to pay attention to. That's a sign your heart might be working harder than it should be. Write that number down and bring it to your next doctor visit. And here's why this matters so much. Researchers followed over 3,000 older adults and found that people with poor heart rate recovery after even light activity like this were 3 times more likely to develop heart failure within the next few years. 3 times. That's not a small difference. That's a number that should make all of us sit up and pay attention. But the test itself is only part of the picture. Most people miss this next part entirely. While you're doing those 10 repetitions, pay attention to how your body feels. How quickly do you get winded? If you're breathing hard after just 3 or 4 stands, that breathlessness means something. Does it feel like the effort is coming from deep in your chest? Not just your leg muscles being tired, but a real sense of strain? That matters too. Think back over the last few months. Has climbing a single flight of stairs gotten harder than it used to be? Be honest with yourself. Your answer might be more important than any test result. Let me tell you about someone I'll call Dorothy. She was 73, a retired librarian, the kind of person who never complained about anything. She came in for a regular checkup and mentioned almost as a side note that she'd stopped taking her evening walks around the neighborhood. When I asked why, she said her legs just felt heavier lately. She figured it was just age catching up with her. But something about the way she described it made me want to dig deeper. We ran some tests that week, and sure enough, her heart was only pumping at about 40% of its normal capacity. She had no idea anything was wrong. The good news is we caught it early enough. With the right medications and some lifestyle changes, she improved dramatically over the next several months. But that only happened because she mentioned that one small detail, and because we didn't dismiss it. If you're finding this helpful, do me a small favor. Just tap that subscribe button so we can keep getting this information to you. It really does make a difference. Now let me walk you through some of the physical signs that often show up when the heart is starting to struggle. These are things you can check yourself, right at home, and they don't require any special equipment. The first one is swelling in your ankles and lower legs. You might notice it more in the evening after you've been up and around all day. Here's a simple way to check. Press your thumb firmly into your lower leg, just a few inches above your ankle bone. Hold it there for about 5 seconds, then let go. If you see a dent that stays there for more than a few seconds before filling back in, that's called pitting edema. And that's something your doctor needs to know about soon. The second sign is something people rarely connect to their heart. It's difficulty lying flat. If you've slowly been adding more pillows over the past few months just to sleep comfortably, if lying flat makes you feel like you can't quite catch your breath, your heart might be sending you a message. A lot of people don't even realize they've made this change until someone points it out. The third sign happens at night. You're asleep, and suddenly you wake up gasping for air. You feel like you need to sit up or open a window just to breathe normally again. This happens because fluid that settles in your legs during the day shifts around when you lie down, putting extra pressure on your heart and lungs. It can be frightening, and it should never be ignored. If you notice 2 or more of these signs together, especially if your sit-to-stand test also showed slow recovery, please don't wait for your next scheduled appointment. Call your doctor within the next few days, not next month, days. Here's something that really opened my eyes. A recent study from a major medical center put this to the test. They took 200 patients with early-stage heart failure and split them into 2 groups. One group just came in for regular checkups every few months. The other group learned simple monitoring techniques they could do at home every day. Things like checking their weight each morning, watching for swelling, doing basic activity tests. After 2 years, the group doing home monitoring had 34% fewer hospital visits. Their condition progressed more slowly. And the difference wasn't some expensive new treatment. It was just awareness. It was paying attention and responding early. So here's what I want you to do. Every morning, before you eat or drink anything, step on the same scale in the same spot. Write down the number. If you gain more than 2 pounds overnight, or more than 5 pounds in a week, that's often the first sign of fluid building up. This takes 30 seconds, and it might be the most important thing you do all day. Do the sit-to-stand test twice a week. Keep a simple notebook where you write down your resting heart rate, your rate right after standing, and your rate after 1 minute of rest. Check your ankles every evening using the thumb press method. It takes 10 seconds. Count how many pillows you're sleeping with, and be honest about whether that number has been creeping up. If you have one of those finger clip devices, check your oxygen level from time to time. It should be between 95 and 100%. If it drops below 92 on multiple days in a row, call your doctor that same day. Now, I do need to mention something important. If you take certain heart medications, especially ones that slow down your heart rate on purpose, your numbers on this test will look different than someone who isn't on those medications. That's completely normal. Talk to your doctor about what recovery numbers are appropriate for you specifically. And please, never stop or change any medication based on what you see in a video. Always work with your healthcare provider on those decisions. If any of this concerns you, if your recovery seems slow, if you're seeing swelling, if you're waking up breathless at night, don't wait. Pick up the phone that day and tell your doctor exactly what you're noticing. Early heart failure responds so much better to treatment when it's caught early. There are medications that can reduce hospital visits by over 20% when started at the right time. Cardiac rehab programs can help. Simple changes like reducing sodium and managing fluids can slow things down significantly. But none of that works if the diagnosis comes too late. This test doesn't replace your doctor. What it does is give you real information to bring to your next appointment. It makes you a partner in your own health instead of just hoping nothing goes wrong. If this video gave you something useful, if it made you think differently about your health or the health of someone you love, I'd be grateful if you'd leave a comment letting me know. And if you have a parent, a spouse, a friend over 65 who might need to hear this, please consider sharing it with them. Sometimes the person who needs this most hasn't found it yet. I'm Dr. Daniel Carter with Prime Health, and this channel exists to give you clear, honest information that actually helps you take better care of yourself. If you're not subscribed yet, I'd love to have you join us. Every video is made with you in mind. Stay well, take care of yourself, and I'll see you in the next one.